Welcome back to SPC Plus. Today we're discussing choice architecture. Choice architecture is a practice of designing the context in which people make decisions. It's based on the idea that people can be influenced on the choices that they are presented with, and the decision-making environment can be designed to steer people to make better decisions for themselves. Choice architecture is rooted in behavioral science, which suggests that people do not always make rational decisions. By designing the context in which people make decisions, choice architects, behavioral scientists, and behavioral change experts can help people make decisions that are more aligned with long-term goals. Let's dive in. Choice architecture is a concept from behavioral science that refers to the way that decisions are presented and structured, and how this can influence people's choices. It is based on the idea that the context in which decisions are made can have significant impacts on the choices that people make, and that the environment can be designed in a way that positively influences decision-making. Choice architecture can be used in a variety of contexts, including public spaces, online interfaces, and health settings. It can be used to design systems, environments, or interfaces, or policies in a way that encourages people to make the most desirable choices, such as choosing healthier options or making more sustainable decisions. Choices are more than just the number of options. It's how they're structured and how they're presented. By designing a context to help people make the right decision, we can assist them in overcoming mental hurdles. This is also based on the idea of libertarian paternalism, which states that it is both possible and legitimate for private and public institutions to affect behavior while also respecting freedom of choice, as well as the implementation of that idea. When considering choice architecture, it's also important to remember the definition of the paradox of choice. The paradox of choice refers to the idea that having too many options can lead to feelings of indecision, anxiety, and regret. It suggests that when people are faced with too many choices, they may become overwhelmed and unable to make a decision, or they may make a choice that they later regret because they believe there may have been a better option available. The concept of the paradox of choice was popularized by psychologist Barry Schwartz in his book, The Paradox of Choice: Why More is Less. One reason that having too many options can be overwhelming is that it requires more effort to evaluate and compare the options. It can be difficult to determine which option is the best fit, and this can lead to uncertainty and indecision. Additionally, the fear of making the wrong choice or missing out on a better option can create anxiety and regret. The paradox of choice can have a negative impact on happiness and well-being, as it can lead to feelings of frustration and dissatisfaction. To address this, some experts recommend setting limits on the number of options that are presented, or adopting strategies such as decision-making frameworks or default options to simplify the process of making choices, because contemporary decision environments offer simultaneously huge numbers of options. Choice architecture can be used in many different contexts, including public spaces, online interfaces, and health settings. For example, it could be used to design public spaces in a way that encourages people to take the stairs instead of the elevator, or to make it easier for people to choose the most sustainable options when shopping. In online interfaces, choice architecture can be used to make it easier for people to select the most desirable options when signing up for a new service. In health settings, choice architecture can be used to encourage people to make healthier lifestyle choices, for example, by making healthier options more convenient or providing incentives for choosing them. Choice architecture can also be used in child welfare settings to influence the decision of children and families. It can be used to provide information and resources to families in a way that encourages them to make informed decisions about the care of their children, or to motivate them to take action such as attending counseling sessions or participating in advocacy activities. By using choice architecture, it's possible to create an environment that encourages families to make decisions that are in the best interest and that benefit the child. Here are some examples of how choice architecture could be applied in the context of child and humanitarian aid. By making certain options default, it's possible to encourage people to choose them. For example, distributing nutritious food in humanitarian efforts. The way that choices are presented can influence people's decisions. For example, if a program is trying to encourage people to use a particular water treatment method, it could frame the choice as a way to protect the health of their families rather than just as a way to purify water. Anchoring could be used to influence people's decisions about the use of resources. For example, if a program is trying to encourage people to use resources more efficiently, it could provide them with information about the average amount of resources used by other families in their community. This could serve as an anchor, influencing people to use fewer resources than they might have otherwise. By making certain options more readily available or visible, it's possible to influence people's choices. For example, if a program is trying to encourage people to use a particular type of fuel-efficient stove, it could make these stoves more readily available within the community. By providing subtle cues or suggestions, it's possible to influence people's choices without directly forcing them to make a certain decision. For example, a program could use signage or other visual cues to encourage people in the environment to use a particular type of water treatment method or adopt a certain behavior. Here are some specific ways in which each examples of using choice architecture could help children in South Asia and implemented in practice. Encouraging healthy behaviors. To encourage children to make healthy choices, the school could place healthier food options in a more prominent location in the cafeteria, such as at the front of the serving line. The school could also provide clear labeling of healthier options, such as colored tags or signage to indicate which foods are lower in sugar, salt, or saturated fat. Encouraging education. To encourage children to pursue education, the school could make it easier for children to choose to attend after-school programs or extracurricular activities by making these options more visible or accessible. This could also include promoting these programs through posters, flyers, or providing information during class or school assemblies. Hygiene and sanitation. For hand hygiene in hospitals, a study conducted in a hospital in the U.S. found that providing clear signage about the importance of hand hygiene and making hand sanitizer more accessible resulted in a significant increase in hand hygiene compliance among healthcare workers. Toilet use in schools. A study conducted in a school in India found that providing accessible and clear signage about the importance of proper toilet use and making toilets more accessible and attractive resulted in a significant increase in toilet use and a decrease in open defecation. Water treatment in rural communities. A study conducted in rural communities in Africa found that providing clear information about the benefits of using treated water and making it more accessible and affordable resulted in a significant increase in the use of treated water. Sanitation. A study conducted in urban areas in India found that providing clear information about the benefit of using latrines and making latrines more accessible and attractive resulted in a significant increase in latrine use and decrease in open defecation. Choice architecture and nudge are related concepts that both involve using design and structure to influence people's decisions in a specific way. Summed up, choice architecture is a purposeful organization of information to make the best option, as considered by a decision maker themselves, the most appealing. It is important for UNICEF to choose choice architecture when doing programming for a number of reasons. 1. To improve outcomes for children. By using choice architecture to encourage families to make decisions that are in the best interest of their child, UNICEF can help to improve the well-being and outcomes of children around the world. This could include encouraging families to seek medical care for their children, to enroll their children in school, or to engage in other activities that benefit their children's development. 2. To empower families. By providing families with clear information and resources, and by making it easier for them to make informed decisions, UNICEF can help to empower families and give them the tools they need to make the best possible decisions for their children. 3. To promote sustainability. By using choice architecture to encourage sustainable behaviors, such as conserving resources or adopting environmentally friendly practices, UNICEF can help to promote sustainability and protect the well-being of children and families in the long term. And to encourage behavior change. Choice architecture can be an effective tool for encouraging behavior change, and this can be particularly important in the context of child welfare. By using choice architecture to motivate families to take action, UNICEF can help to promote positive behaviors that can improve the well-being of children. Overall, the use of choice architecture can be an important tool for UNICEF SBC as it works to improve the well-being and outcomes for children around the world.